Hi everyone, it's another week on My Health with Mo. My name is Moyinoluwa Oshin and I'm a clinical pharmacist. Last week was World Breastfeeding Week. It's usually celebrated from the 1st of August to 7th of August. I actually did a video, but something happened. Anyways, I decided to do another one, better late than never. So we're going to be talking about breastfeeding. The theme for the week is Protect Breastfeeding, a shared responsibility. Breastfeeding is natural, and I must say it sometimes may not be easy. But it varies from mother to mother. The experience varies from child to child as well. So the experience you have with your first child may be different from the one you would have with your second child. Breastfeeding is something that every mother must do to ensure their child's health and survival. We're going to be talking about benefits of breastfeeding later on. But before that, I would like you to know that breastfeeding should start within 1 hour of birth, because it's not just about nutrition, it's a neurological behavior, and should continue for the next 6 months. Some do for 7 months, but 6 months exclusively without giving water or any other thing. I know the question that may pop in your mind would be, breastfeeding is food, why can't I give water? You can't give water because the composition of breast milk alone has 87% of water. So you see that it's enough to quench a thirst or fill up the need for water. It has 3 other things, which are lactose, protein, and fat in minute quantity. So breastfeeding should be continued for 2 years plus complementary feeding, that is giving additional meal that will satisfy the child, because the requirements of the child vary with age and the need at a particular point in time. How often should you breastfeed your child? You breastfeed 8 to 12 times within 24 hours. Some doctors say breastfeed on demand. It's good. I did that with my second child, and it didn't end well because each time she sucks and oversucks and then she begins to vomit. So I had to put a time to it. But normally 8 to 12 times within 24 hours is appropriate. It's been documented that mothers who breastfeed have reduced risk of breast and ovarian cancer. So why not breastfeed your child? It's also important that if you have cracked nipples, please seek help. A lot of mothers tend to apply Vaseline or shea butter. I have done it myself, but it can be very cumbersome and unhealthy if it continues. That after applying for a couple of times and you still find that the nipple is still cracked, it's better to seek help in a hospital. Then a solution can be preferred and find out why you keep having cracked nipples. Should you wash your breasts or the nipples before breastfeeding? It's not necessary, because the nipples have good bacteria that help to prevent infections. So what you can do, you wash your hands just as we've been doing for 20 seconds with soap and water. And in the absence of that, you can use hand sanitizer with at least 60% of alcohol content. What are the benefits of breastfeeding anyway? Number 1, it boosts immunity, because the breast milk has immune cells, stem cells, and antibodies that are necessary for the immune functions. It helps to support the growth of your baby. It provides nutrition because there are vitamins and minerals in the breast milk. It also helps the baby to adjust to life outside the womb. So when a baby is born, you place the child on the mother's body. It calms the baby enough to begin to seek the breast. And then the breast milk has hormones and enzymes that also help with this. Breast milk helps to reduce infant mortality rates, as well as reduce risk of infections such as respiratory tract infection, allergies, diabetes, and even childhood leukemia. This has been documented. So why not breastfeed your baby? And then breastfeed also provides exposure to new flavors, that is through the diet of the mother. So what you eat is excreted in breast milk in a little quantity, and it helps your baby to begin to develop its taste buds to different flavors of milk, so that when the time to transition to complementary feeding comes, it makes it easier for the baby. However, during this pandemic, when it started, a number of baby product manufacturers began to invoke fears in mothers, saying that COVID-19 may be transmitted through breast milk. This is not true. And then they began to position their products as safe and better for nursing children. It is not true. COVID-19 is not transmitted through breast milk. So how do you protect breastfeeding and make it a shared responsibility? Number one, it's important to ensure that international code for marketing breast milk products are put in place so that we can avoid such instance that I just mentioned. Number, we must ensure that healthcare workers, that is me, other doctors, midwives and nurses, have resources to support breastfeeding mother and provide information that is required at every point in time. And lastly, ensuring that employers are allowed to have paid parental leave. Kudos to all the states that have implemented 6 months maternity leave. It's fantastic. Recently, Oyo State also joined, Lagos State, Ekiti State. So you can have that and also breastfeed your baby exclusively for 6 months without interference or without you thinking I have to resume work after 3 months. Also, access to affordable and quality child care centers. It's very important. Also, safe places that breastfeeding can take place. I've seen a lot of mothers being shamed for breastfeeding in public. Fine, we understand that you can't just bring out your breast. So I suggest there are breast feeding apron that can be purchased from mother and child product sellers. So please get one. You just wear it as an apron over your neck, and then it covers you and the baby while breastfeeding, so you can breastfeed in public and you won't be ashamed to bring out your breast, or other people will not feel embarrassed by the process. I hope you have learned 1 or 2 things today. If you have, please share with your sphere of influence, with your family and friends. Also, help me grow my channel by subscribing and liking this video. Till I come your way next week, stay healthy and enjoy life. Bye.